Welcome students. I am starting Journey to Surgery in Paramedical Students by Dr. Orko Bandyopadhyay, MBBS DNP. Today's topic is shock. What is shock? You should know. Shock is defined as a state of cellular and tissue hypoxia with circulatory failure, that is collapse. And what is the ultimate result? It results poor perfusion. So, if shock is defined as the main thing is poor perfusion. Shock means poor perfusion. It may be from any causes, that is cellular hypoxia and tissue hypoxia and circulatory failure is the main pathological feature. So tissue perfusion you should remember always shock means tissue perfusion. Causes of shock. What are the causes of shock? Most common is septic shock. It is 62% due to bacterial infection which releasing toxin leading to shock. And next is in our country also hypovolemic shock. Hypovolemic shock is found in 16% patients, whereas septicemic shock found in 62%. So, hypovolemic shock had many causes. First thing, the pathology is due to reduction of total blood volume. And it is due to hemorrhage, severe burn, peritonitis or intestinal obstruction, and vomiting. All these things causes hypovolemic shock. Next is common is cardiogenic shock. Acute myocardial infarction, that is the acute carditis. Number 2, acute pulmonary embolism. Number 3, cardiac compression, that is cardiac tamponade. Tamponade means when there is in the pericardium there is fluid and which causes pressure over the heart. So it is cardiac compression. And trauma to the heart from any cause, trauma. These are the cardiac causes of cardiac compression. So the cardiac compression had two causes, cardiac tamponade and trauma to heart. Next is cardiac surgical compression. Sometimes it is occurs in lap chole also, by laparoscopic operation, when there is abdomen is full of carbon dioxide, it presses over the diaphragm and it also presses the heart, and which may cause cardiac failure or cardiac stoppage. Next, toxemia from any cause. Toxemia causes whole body septicemia or whole body vascular spaces are deranged, and which causes reduced blood supply to the heart and it causes cardiogenic shock. Next is drug induced. Some drug causes heart. Drug induced, that means some drug can affect over the heart and it causes cardiogenic shock. Next is the anaphylactic shock, which is very common. Hypersensitivity reactions from any cause, from the drug, from the food, or from the allergic reactions, from the air, that is anaphylactic shock. And number 5 is neurogenic cause, that is painful stimuli. Always any painful stimuli causes splanchnic vasodilatation. You also see in endoscopy there is gas and which causes pain, and sometimes patient are disoriented or fall. It is from splanchnic vasodilatation, all the bloods in the splanchnic vessels, that because of body try to supply the blood to the vital organs like liver, kidney and others. So there is hypovolemia, and which can cause neurogenic shock, and it sometimes causes cardiac arrest and patient may die, or patient can recover spontaneously. Next is the important is respiratory shock. Respiratory shock found in atelectasis, that is the collapse of the lung. When there is infection or in the foreign body, or sometimes there may be malignancy which can consolidate the lung, and most common in elderly age group or postoperative patient is atelectasis. There is collapse of the lung. If we see the X-ray, you will see the white portion of the lung. Next is thoracic injury. Thoracic injury can cause severe damage to the lung. Thoracic injury, ribs may be fractured, or there is air from the outside can go into the lung and lungs collapse may be found, and respiratory distress, severe respiratory distress. So thoracic injury, in case of thoracic injury, always do, if any respiratory distress found, always do a water seal drainage to save the patient, or sometimes two sides of the rib, 3 or more may be fractured, and it is called the flail chest. And if the flail chest occur, there is also respiratory distress. So first fix the flail portion. Next is tension pneumothorax. Tension pneumothorax is very common after injury or after there is rupture of the bully from the lung in case of elderly patients. And other thing is the anesthetic complications. Anesthetic complications, always use the tube to ventilate 2 lungs, but if there is some obstruction or any other causes, sometimes 1 lung ventilation occurs, then the other lung is become non-functional. Then it will recover after treatment. And other causes, which include only 2%, are the adrenal insufficiency, that is the Addison's disease, or thyrotoxic crisis, and hypothyroidism, that is mixed edema. In thyrotoxic crisis, heart beat is faster and it sometimes causes heart failure. So these are the most important causes of shock. You should remember always. Thank you for watching this video. Share more and more to your friends and subscribes this channel for new update.